whatever is there in the literature scientifically available. Now coming to dementia as such. So dementia is a process marked by progressive cognitive impairment in clear consciousness. Now here there are two important points. One is progressive cognitive impairment and the other thing is clear consciousness. Now cognitive impairment, cognition itself is a huge topic. There are a lot of things which are there in the cognitions. Now, in dementia, when we are talking dementia, the cognitions which we are talking mainly are related to memory. So, commonly, patients come with complaints of forgetfulness. So, that is what is the most common presentation. That is which is occurring at the clear consciousness. Now, clear consciousness meaning whatever the is going on around the person, the person is very well aware of. That is what is in the consciousness. Now, if there is any impairment of consciousness and there is cognitive impairment, we usually cannot place it under dementia. Now, of course, in the late stages of dementia, when the consciousness is altered, in late stages of dementia, consciousness can be altered along with the impairment. Now, what is the disease burden? Dementia itself, there are around more than 55 million people worldwide, and almost 10 million new cases add every year. So, it is a huge burden, especially in case of elderly people. Now, when I say elderly people, here the age is more than 60 years. When we compare with other disorders or other diseases which cause disability, mortality, and morbidity, dementia is the seventh leading cause for that death. To go into some basic aspects of types of dementia. Now, basically, dementia can be divided into reversible and irreversible types of dementia. Now, reversible dementias are those where there is a underlying cause, and once identified and treated, the dementia comes back to normalcy. So, the patient can be reverted back to normalcy. Whereas in case of irreversible dementias, the cause or the etiology is such that whatever we do, we cannot stop the or halt the process, and the disease keeps on progressing, and it becomes disability over a period of time. Now, under irreversible causes of dementia, we have different types like Alzheimer's dementia, vascular dementia, frontotemporal dementia, Lewy body dementia, etc., etc. Now, each one has a different way of presentation, and each one has a different way in which it is managed. Now, among these irreversible dementias, the most common type is the Alzheimer's. It is attributes to around two-thirds of the cases of dementia, followed by vascular dementia. Now, when I say vascular dementia, there is an underlying problem where the blood supply to the brain is impaired, as a result of which the parts of the brain which are where the blood supply is impaired, it is damaged, and that causes dementia. Now, moving on to Alzheimer's dementia. Now, I'll try to concentrate more on Alzheimer's dementia because Alzheimer's dementia is the most common type of dementia which we come across clinically. Usually, Alzheimer's dementia is seen in ages above 60 years. There is another variant which occurs below 60 years. It's called early onset, but it is a very rare kind of a type. Now, Alzheimer's dementia is named after a neurologist who identified this disease initially. He goes by the name of Alois Alzheimer, and in honor of him, it has been named as Alzheimer's dementia. Now, what happens exactly in Alzheimer's dementia? You see, the brain of the person who is affected, the brain actually the size of the brain reduces. So here you can see the healthy brain and the shrunken brain. The brain in case of Alzheimer's dementia, what we say it as the gray matter actually reduces in size, and whatever the spaces which are there, they get enlarged. Now, why this happens? It happens because of a lot of etiological processes which are going on. Currently, according to our understanding, there is some protein which is deposited in the brain, and normally this protein gets removed off from the brain by a lot of processes. But in case of Alzheimer's dementia, what happens is that the protein impairment, that is the removal of the protein, is not possible, and it gets accumulated. Because of it, it gets accumulation, it causes inflammation, and that causes in the loss of the neurons. So that's how the gray matter decreases in size, and the ventricles enlarge in size, and because the gray matter is reduces, the cognitive reserve or the cognitive functioning decreases. Now, what are the most common symptoms which these patients present? Now, this is common for all types of dementia. So, most common presentation is difficulty in learning or memory, followed by attention, executive functioning, language, social cognition, and perceptual memory. In layman terms, what happens is that initial complaint will be forgetfulness. So the patient will say that I am forgetting things, or they would say that previously I was able to do simple mathematical calculations, or I was able to remember doing these things, I was able to make decisions, but now I find it very difficult to do all these things. Or sometimes the patient relatives or near and dear will say that the patient is saying that the food is not given, or he is unable to remember the recently seen people and all this. So these are the common ways in which this dementia presents. Now, according to WHO, there are different stages in which the dementia can be seen. So early stage, middle stage, and late stage. As I had mentioned, as the disease progresses, the symptomatology keeps increasing, and the problems also keeps increasing. Along with that, complications keep increasing. So, what are the options available? Once the dementia sets in, so it's a difficult process. The current, whatever the medications we have, they try to target the neurotransmitter. Neurotransmitters are the chemical substances which are there in the brain. Now, in this case, in Alzheimer's dementia, it is acetylcholine which is targeted. So, the drugs which are there, they try to increase the acetylcholine, and they try to improve the memory and other functioning. Now, the problem is these drugs usually do better in case of early stages, but as the disease progresses, it becomes difficult. And another important thing is that the current available medications do not stop or unable to stop the underlying degenerative process. So it is like the process, the underlying degenerative process is going on. We are trying to do some kind of a patchwork in order to improve the symptomatology, but it will not completely hold it. Of late, the research is focused on trying to identify and trying to stop this degenerative process. Like in the previous slide I had mentioned, there is a deposition of A beta amyloid. Now, this is a protein which is getting accumulated, so why not clear it off? So, the current medication or the current research, what they are trying to do is that they are trying to accelerate the removal of these proteins, so in order to prevent the further process of degeneration. Now, when all this is occurring, why not try to prevent it? In medicine, we have something called as this prevention pyramid. So we have something called primary prevention, secondary prevention, and tertiary prevention. Now, what are the pharmacological or the medication or the drugs which I mentioned are mainly in the tertiary prevention stage. That is, when the patient is above 60 years and the symptoms have already started, they have been noticeable. That is when the patient comes to us clinically. So we do something called as tertiary prevention. So here we try to give medication, we try to slow down the process of degeneration, and try to do as much as possible to prevent the complications. Now, in case of dementia, whether anything can be done before that. So that is what comes under primary prevention. Primary prevention is where the disease process has not even started. The risk factors are there, and trying to control the risk factors in order to prevent the future onset of this disease. So that is what is primary prevention. Now, today's goal of my presentation is to highlight on this primary preventive steps which can be taken, which are practicable, and when applied on a long-term basis, they can prevent dementia. So, coming to whether is Alzheimer dementia preventable? Now, the problem here is we exactly don't know the etiology. Now, I mentioned that there is a deposition of E-beta amyloid, but when a lot of research has gone into trying to identify whether medications in order to prevent this deposition and help in clearance of this A-beta amyloid protein, whether they are helpful. But the research is not very promising. So we are back to square one in trying to identify what exactly is causing Alzheimer's dementia. So currently we we believe that there is a multifactorial causation. So there are a lot of factors which are involved which can lead to Alzheimer's disease. So it is a complex interaction among aging, so genetics, so there is a family history of already Alzheimer's dementia, lifestyle changes, and environmental factors. All this probably add on and it can cause Alzheimer's disease. So in this, the primary risk factors are ApoE epsilon E4, epsilon 4 genotype. This is one of the gene which has been identified, which is related to the onset of Alzheimer's dementia. Head injuries, family history, low education, low participation in the cognitive stimulating area. These are some of the risk factors which are identified. So, why not identify and catch these risk factors early, whether that can be done? So, here I have divided the risk factors into four main headings: cognitive activity, physical activity, diet, and physical limits. Some of these risk factors can be modifiable. So why is I say some? Because genetics are something which cannot be modifiable that easily. There are some risk factors which develop dementia. So those can also be used as targets for intervention. For example, cognitive inactivity. So that is a risk factor for causing dementia. So why not target cognitive inactivity and increase the cognitive activity? Whether that can help in preventing dementia. Now let's start trying to identify what are the different modifiable factors. So first I'll start with the cognitive activity or cognitive training. Now in a lot of research it has been already been established that education is one of the important risk factors for the onset of dementia. So engaging in a highly complex mental activity acts as a protective factor against the development of dementia. So here, when I say highly complex activity is like if a person who is working as an accountant, so he's always busy with his numbers, calculating or doing some kind of analysis and all those things. So that kind of activity will try to prevent. Similarly, a person who is at the same time a person who is involved in doing some cognitively stimulating activities like doing solving some puzzles or some sudokus or solving some crosswords, those are also come under highly complex mental activities. So involving in these kind of activities is known to prevent the onset of dementia. Then there are other studies also trying to identify whether learning a new language, probably you would have already seen, learning a new language actually helps in preventing dementia. This has already been proved in many studies. So a person who is able to speak in two languages at least, so that again helps in delaying dementia. Now, of course, what they say is that learning language early in the age is much more helpful. But in the as the age progresses, as we try to learn a new language, that itself is a cognitive stimulating activity. Now, there is a concept called as cognitive reserve. Now, cognitive reserve is a brain's ability to improvise and find alternate ways of getting a job. So, for example, we are facing a difficult situation. In the past, we have faced a situation and we handled in a different way. Currently, we are unable to handle in the same way. So, trying to find a way in order to find a solution or find a way through the problem is what is the brain's cognitive reserve. Now, this can be developed by a lifetime of education and curiosity. So that is what probably you would have seen that we should keep learning every day something or the other, which is something which is new, which is very curious, or if you're curious about something, keep learning something. So that is what when we are doing these kind of learning activities, the cognitive research keeps increasing. Now, researchers have found that those people who keep on doing learning something, they found that they do not have symptoms of dementia, but after their death, when they have done autopsy, they found that the brain had changes which are similar to of Alzheimer's disease. So, even though the brain, even though there is underlying Alzheimer's disease process which is going on, but those people who have a good cognitive reserve or improving, they do not have any kind of a preservation. So individuals with greater cognitive reserve, they can stave off symptoms of degenerative brain changes associated with dementia or other brain diseases. So this is about this cognitive activity. There is again a study. This is a randomized control trial. So randomized control trial is where they select randomly individuals and they try to give some intervention, and then they see after this intervention whether there is any improvement or not. Now, in this study, what they have done, they given some cognitive stimulating interventions, and they found that these cognitive stimulating interventions, when they are given over a period of time, they actually improve the cognitive result. So, long term, we can attribute that. We can say that probably this can be used. This cognitive improving the cognitive reserve can be used to prevent dementia. Now, moving on to the second risk factor, that is physical activity. Now, this is something which has been very well researched, and there is a lot of literature which is available. What it says is that remaining physically active is actually preventing dementia. So what happens is that basically in the brain there is a chemical called as BDNF, which is stands for brain-derived natriuretic factor. This actually appears to play a role in on the effect of exercise on the synaptic plasticity. Now, just a few words about plasticity. Plasticity is nothing but the ability of the brain to change itself. Now, brain, unlike other organs of our body, has the capacity to grow, to change itself, to add new connections and add neurons. Now, this kind of ability is very limited to other organs, like when we say kidneys or lungs. They do not have this kind of ability. Previously, we thought that brain also doesn't have this ability. It was there only. It was thought to exist only in the childhood, but now it is proven that throughout the age, even in the elderly age, this ability of the brain exists. Now, that is what happens when we do physical activity that increases BDNF, that in turn causes more of plasticity. So, exercise, what it is found to have is it increases the expression of these genes which are related to the actions of BDNF, and that in turn plasticity. Now, exercise, when I say exercise, the more evidence is for the aerobic exercise. So aerobic exercise is where the person is exposed to the external environment or the nature, where there is free oxygen, where there is a lot of stimulating thing which is going on. So that is what is aerobic exercise. So that again, aerobic exercise also improves the cerebrovascular and also cardiovascular risk. So in turn, it is like a multifactorial in preventing dementia. So this was a study which again there was a study which they have used in adults, where they have given an intervention of physical activity and no physical activity. They have done this intervention for a few years, and they found out that those who are doing the physical activity for a long period of time, their uh, the in the brain, they found that the decrease in the particular areas is very much reduced. So leisure time physical activity, it decreases. Leisure time physical activity means when the person is away from all the activities and spending time leisurely. During that time, any kind of physical activity also decreases the risk of dementia. Then coming on to this vascular risk factor. Now, vascular risk factor is more in association with the vascular dilation. Now, vascular means the blood vessels. That is blood associated with the supply of the blood to the brain. Now, that also has a risk factor in causing Alzheimer's dementia. Now, the main important things which control this vascular factors are the blood pressure, diabetes, and atherosclerosis. These are the three important things which come to our mind when we think of these vascular factors. Now, it has been found that increase in blood pressure during the midlife, it increases the chance of dementia and Alzheimer's disease. So it indirectly means that during the midlife, if there is a diagnosis of hypertension, that needs to be treated, and the blood pressure needs to be maintained at a particular acceptable range. So that prevents the end organ damage to the blood vessels. So that in turn prevents dementia. Again, in case of elderly, lower blood pressure is again associated with dementia. Now, what happens is that in elderly individuals, already the blood vessels are a little fragile. So what happens is that when there is a higher blood pressure, they can easily break and that can cause stroke, or what we say it as the blood gets released in where it is not supposed to be there. So that causes damage. So decrease in blood pressure in the elderly again is a risk factor. So maintaining the blood pressure in the normal range is what is required. Similarly, coming to diabetes mellitus, what happens in diabetes? There is a decrease in production of insulin. So, as a result of which, what happens is that the glucose which is there in the blood is not taken into the cells. So, it circulates along with the blood throughout the body. So, as it keeps circulating, what happens is that the fluidity of the blood decreases and it becomes difficult for the blood to reach the end organs. At the same time, the glucose gets converted into fat gets deposited, that in turn leads to atherosclerosis. So, longer duration of diabetes mellitus has poorer cognitive function. Now, this is again proved beyond doubt that in those patients who are diagnosed diabetes and they are not taking or not maintaining their proper diabetes control, they have a poor cognitive function. Again, cholesterol lowering drugs. These are the drugs which are used in case of atherosclerosis to prevent the deposition of this cholesterol and all those things. So these are indirectly found to reduce Alzheimer's. And LDL is nothing but what we say in layman term as bad cholesterol. So that again, the increase in the bad cholesterol increases the chance of dementia and cognitive impairment. Similarly, hypercholesterolemia also increases deposition of cerebral A beta peptides, amyloid plaque formation. These are all supposed to be some of the theories which are related to Alzheimer's dementia. So, overall, maintaining good vascular health is what is very important, and this is what also been found in this study. Now, coming over to the diet, now if you would have seen a lot of emphasis being placed on the diet. A lot of people say that this kind of a diet is what is important, and this keep changing over a period of time. Previously, there were a lot of emphasis which was based on this saturated fatty acids. So those which are present in some of the cooking oils. So they are supposed to have a lot of problem on the heart also. Similarly, they also have some negative effects on the cognitive reserve. So they what happens is that increase in saturated fatty acids is associated directly associated with the cognitive decline and mild cognitive impairment. Mild cognitive impairment is nothing but a prior stage to the onset of dementia where the features are not very evident, but sometimes they can be clinically detected. And over a period of time, they might progress into dementia or might not progress into dementia. Whereas the opposite of saturated fatty acids, we have something called as monounsaturated fatty acids, which are polyunsaturated fatty acids. What we probably would have heard is this omega capsules, which are actually derived from this fish oil. Decrease the cognitive, decrease the progression of cognitive decline and dementia. Again, there are studies which prove that these substances actually do reduce the or act as a preventive measure for the dementia. Again, decrease in consumption of milk and dairy products has a poor cognitive function and increases vascular dementia. And there is a particular type of diet called as Mediterranean type diet. It is shown to slow cognitive decline and decrease the risk of progression from mild cognitive impairment to Alzheimer's dementia, and probably could also decrease the mortality in Alzheimer's dementia. Now, a little bit about this Mediterranean diet. There is actually a lot of research which is going on in trying to identify how much this Mediterranean diet can prevent dementia and what are its applications in other diseases. Now, what exactly does this Mediterranean diet include? So, it includes using of olive oils, legumes, unrefined cereals. I mentioned unrefined cereals, fruits, vegetables, high consumption of fish, moderate consumption of dairy products and wine, low consumption of non-fish products. Now, Mediterranean diet includes all of this, not a single one of this. So, when we are planning a diet, which we say it as Mediterranean diet, these all should be included, not just a single thing. So, some might say I'm using olive oil, so why not? It's not preventive. So, it is a combination of these things is supposed to have some beneficial effect. And then it is associated with better cognitive functioning after 6.5 years of follow-up compared with the control group. And this was also there was also a study which was trying to use extra virgin olive oil. So extra virgin olive oil is a little more refined form of the olive oil, where they found that using of this extra virgin olive oil found to have improved cognitive than the low fat. Now these are the different studies. I just placed some cut out screenshots of these studies where they have done and what they have found out. And then coming to the wine consumption. So as a psychiatrist, what happens is that whenever we come and discuss about this alcohol, most of our patients will be happy that they're taking alcohol and but here the important thing is that the studies have been done only in trying to identify wine and not other types of alcohol. And again, in wine, what they say is that not more than 1 to 2 glasses of wine per day. So when the persons has taken more than 3 to 4 glasses, the effect is not there. In fact, there is a lot of negative effect. Again, this topic on this alcohol and related positive effects on the health is a very debated topic. Recently, I had come across some of the literature saying that even a little amount of consumption of alcohol is bad for health and also has negative effects on dementia. But some of the studies in the past have shown that only consumption of wine has some kind of a positive effect. Now, why that positive effect? It is because of the presence of antioxidant and anti-inflammatory properties of a substance called resveratrol and melatonin, which are there in the wine. So that is the reason why when we say alcohol and positive effects, we say mention only wine and not other types of alcohol. Smoking, again, this is a very controversial topic. Few years back, it was thought to have some positive effects on the dementia, but now there is a lot of literature saying that it has a negative effects on dementia, so it increases the risk of dementia. Now, obviously, when we see what smoking does, it increases oxidative stress and inflammatory responses. So indirectly, what it does is it increases the substances which causes more of inflammation and more of degeneration. So obviously, when these things keep happening, obviously the brain parenchyma keeps losing, and of course, it becomes an important factor for the onset of dementia. So, stopping cessation of smoking itself has other health benefits also, like it decreases heart rate, heart cerebrovascular morbidity also. So smoking, cessation of smoking has a positive effect also in the dementia. Stress management, of course, most of you are probably much very well aware that stress needs to be managed. Now, stress is important actually. If you remember during our exam time, if the stress is not there, we wouldn't have prepared very well and probably we wouldn't have achieved good marks. So, stress plays an important role, but at the same time, stress needs to be under control. So, having a properly managed stress and how we are able to manage stress is very, very important. Now, what stress does? It increases a lot of hormones, a lot of chemicals in our body, and that in turn activates something called as a fight and flight response. Now, when we are always in this fight and flight response, obviously the changes over the end organs, that is the brain, it increases. So it causes more of damage to the brain, and the more the damage, obviously, it is a causes the progression of Alzheimer's dementia. Coming over to the sleep. Now, sleep. Uh, what happens is that sleep again is a very important thing. Sleep is actually necessary for formation of new memories. So when we are as a student, when we are learning something, if sleep is not there, our memory cannot get consolidated. So we cannot remember for a long periods of time whatever we have learned. Sleep also has a important role in stress. So when we have an adequate sleep, stress also reduces. But at the same time, stress also decreases sleep. So sleep wake abnormalities are associated with the presence of amyloid deposition in the preclinical stage of Alzheimer's dementia. So probably here what I am saying is that Alzheimer's dementia initial presentation can also have disturbances. At the same time, as the disease progresses, also sleep abnormalities will also be noticed. So sleep abnormalities, there is increase in the soluble A beta levels over long term, increased chance of plaque accumulation and sleep disruption and symptomatic degeneration. Moving on to meditation, probably Deepika ma'am can add more onto that, but a few points from my side is there is evidence that meditation has a positive effect on stress reduction, psychosomatic disorders, blood pressure, and cardiovascular disease. Over a period of time, we are noticing a lot of literature saying that meditation has a lot of positive and beneficial effects over the health. So, when a patient comes to us, we usually advise lifestyle modification, and in that, we usually give an option of meditation. Of course, initially it will be very difficult for the person to start meditating, but once they get a hang of it, it becomes a habit. So it has a lot of cognitive and positive stimulating effects. Now, there are a lot of trials which are conducted in trying to identify whether meditation can prevent dementia. So it is proven that meditation over a long period of time can prevent dementias. So in neurodegenerative disease like Alzheimer's dementia, it has positive impact on memory and attention. It is found to reduce the hippocampal atrophy. Now, the hippocampus is a part of the brain which is specifically involved in memory. So it reduces the size of the it prevents the reduction of the size of this hippocampus, and obviously the functional connectivity is improved. Social engagement, of course, this was not a major issue during the past when we had this more of joint families, but now we are trying to follow the Western culture and we are trying moving more towards a nuclear family kind of a culture. So what happens is that our elders are separated, we are staying separately, our children are staying separately somewhere else, doing or busy in our activities. What happens is that when we are in the activities, we are doing well, but once out of the work or out of the activities or after retirement, what happens is that there is a poor social engagement. A poor social engagement, indirectly it means there is a decrease in the cognitive stimulating activities. So obviously the one which is not used, obviously it gets atrophied. So what happens, they are susceptible to cognitive decline. So risk of mild cognitive impairment is increased, and there was a study which was trying to find whether there is the risk of developing dementia is reduced when the elders are staying with the children or siblings, and they found a positive association. Again, participation in socially engaging activities is associated with reduced risk of dementia. So what happens is that when a person is involved in a socially engaging activity, they are discussing a lot of things, and at that time there is a cognitive stimulating activities is going on, so it prevents the onset of dementia. So I have mentioned a few things what can be done, like for example diet, physical activity, cognitive activity, social engagement, and a lot of things. So normally a question would arise whether using a single thing can prevent. Yes, a single thing can have impact, but usually a multimodal thing that is combining different things and adding them to our own lifestyle has a major impact. So that is what has been proved in this studies where they have used different approaches to prevent the onset of dementia. So multimodal here I refer is more than using one behavioral intervention. So they found that it has a greater influence on the neurobiological mechanisms underlying the cognitive decline. So a study which was done, including 4 months of exercise and frontal cognitive stimulation. So frontal cognitive stimulation is where they use the different activities, which they are given different activities, like for example some crosswords or Sudoku or puzzles, something like that. They have done this for a period of 4 months. Just with this 4 months, they observed statistically significant differences. So what I mean to say is that clinically there was improvement which was noticed. So combination of diet and exercise can also deliver more beneficial effects than single interventions. So this was a study. Again, this is a trial which was conducted, which they used different modalities over a period of 2 years. What they used is nutrition guidance, exercise, cognitive training, social activity, management of metabolic and vascular health. When all these things are managed, or when all these things are included as a part of a lifestyle, what they observed is that it helps in preventing the onset of dementia. Again, a similar kind of study where a multimodal intervention was used using the coach supported platform, and they had included self-management of cardiovascular risk factors, vital priorities, goal setting, feedback. It included a lot of cognitive exercises. So what they found out is that when these things are included, there is an improvement in the cognitive functioning, and in turn preventing the onset of dementia. So finally, take home message from my side: dementia is a disease which affects the brain, and there are interventions to prevent it. Some of the interventions which I have discussed are exercise, diet, controlling vascular risk factors like keeping the blood pressure under control, keeping diabetes, atherosclerosis under control, involving in socially engagement activities, cognitive stimulating activities, and combining or multimodal approach is better than using any one of the approach. So, okay, I'll end my presentation with this, and there are any questions, we'll take them.
Thank you, sir, for this enlightening presentation, and it was really wonderful and knowledgeable. So now I would ask everybody to ask their questions. We have Kumar raising their hand, and also you can ask in the chat box if you want to. I'll read out your questions, or you can switch on your mic and ask your questions as well.
So this is an open platform. Anybody can ask any kind of questions related to it. Whatever
So
hand is there,
can you
yeah.
so can you elaborate about synaptic plasticity?
Okay. So this is again a different. What you say? It's there is a lot of research on this. So that itself is an individual topic. But I'll say basically, synaptic plasticity is where the brain keeps changing itself. So it keeps adding new connections, new neurons. Like for example, I'll give you an example. You're learning a new language. So new language itself is a cognitively stimulating activity. So that requires a separate, what you say, connections and pathways. So when we keep doing this again and again, these connections and pathways are formed again and again. They get consolidated, and that is what is synaptic plasticity. Now,
Thank you,
clinically,
sir.
what we see is that in these cases, young patients who had road traffic accidents, so they have a lot of disability, so they'll not be able to talk. They have a difficulty in remembering and all those things. But over a period of time, what they say is that at least a period of 2 years, when it is given, the brain changes, it reorganizes. And clinically, what we observe is that relatives keep saying that over a period of time, he's improving actually. His aggression comes down, and he starts talking. He starts learning new things. So that is the magic of this synaptic plasticity. Probably from my clinical perspective, I had given, but I'm not given you the neurochemical biology and all those things.
Thank you, sir.
Thank you.
Yamini has raised her hand.
Uh, Hello, am I audible?
Yes, yes.
Good evening, sir. So I would just like to ask this question. Like you mentioned that in secondary phase of this Alzheimer, you can you can slow down the process, but you can't. Like, is there? So does the patient come back? Like there are chances that the patient would come back to his or her normal state, or the case will worsen. Like the case will go worse enough, or like the situation is going to be more and more difficult and hectic. So what's that?
Okay. It's a very nice question. So secondary prevention is where the disease has already started off. So even when we try all these things, probably we cannot stop the process. We can maybe we can slow down the process. That's it. Whatever the interventions I mentioned are mainly for the primary prevention where the disease has not still started. Okay, especially in case of Alzheimer's dementia, once the disease has set in, we don't have anything much to be to completely stop it. So what are the medication are there? They can slow down the process. That's it. So once a disease has started, like Alzheimer's, there is no way going back to normalcy.
So, sir, it's more or less similar to cancer. Like we don't have a particular cure for it, like exact cure.
Okay,
Okay, thank you very much.
I don't exactly compare with cancer because cancer it is different from each type of cancer, and with each day there is a lot of improvement. But Alzheimer's is slightly different from that, I would say.
Okay, sir. Thank you, sir.
Akula has asked, how can we personally help someone in our family who has dementia?
Okay. This is the common thing which we come across when we first make a diagnosis of dementia in a patient. So what we do is that we sit with the patient caregivers or the relatives. Most commonly, there would be their children or it could be spouse. Most important thing is we need to tell them that this is a slowly progressive disease, and there will be a lot of help which will be required from their side to help their patient. So it becomes so that as it progresses, the person who is having the disease becomes a kind of a child, so they would require help even in their daily activities like eating, taking bath, toilet training, and all those things. So that is a kind of a problem it can cause. So first and most important thing is that psychoeducating them, telling them what exactly is the disease, what is expected, and what are the problems the patient will get into. And then second important thing is that trying to understand their burden. That is very important because if the relatives are unable to manage it, they will not be able to manage the patient. So they need to control their emotions. They need to understand that the dear ones who was taking care of them, they require their help. So that is what needs to be placed. That perspective needs to be placed into their brain. And the third important thing, what are the things which can be done? So there are a lot of things which can be done. First thing, usually as a psychiatrist, as a medical man, we prescribe medication. We say them that, you know, this is not going to entirely stop the process, but it is going to slow down the process and changes in the environment. So that is very important. So they have difficulties in remembering. So what we do is that we make their homes little friendly. So what we do is what we tell them is that place nameplates in front of the room. Uh, like for example, this is toilet, this is their room, this is their bed, and then uh, giving kind of a cognitive stimulating activities, placing a what do you say board where mentioning the date, time, year, and what is for the breakfast, what is for the lunch, and each room having a proper what you say time and all those things. So these are some things which can be done in order to prevent the person getting into complications. So probably this is how you can help someone in our family who has dementia. So I had mentioned two things: caregivers and the patient as such. Hope it answers the question.
Are there any more questions? Akula has said thank you.
Thank
And
you.
are there any more questions? You can type it or ask. Ritu Kapoor has raised her hand. Ritu Kapoor, you may ask.
Okay, sir, am I audible?
Yes, yes, please.
Sir, normally in case of dementia, we've also seen that the patients will be having some kind of gastroparesis, and the constant constipation is an issue with them. So, gut microbiota, because there are a lot of studies which have been going on, they play a very important role. There is a gut-brain axis that is, being worked upon, researched upon. So, sir, according to you, is there any known role of the microbiota? Do introduction of, the lactobacillus or those species, they help in any way with such patients?
Okay, it's a very nice question. Now the thing is that I am aware of this gut brain axis, and there is a lot of research which is going on. Even in case of psychiatric disorders, it is supposed to have a lot of implication because of involvement of serotonin. But then again, I'm not aware of any literature or studies where they have used this lactobacillus in trying to prevent dementia. So I'm really, I need to go back and check whether there is any literature of that sort. But from my knowledge, I don't have any. I don't think they have any kind of a preventive measures. I need to check back the literature again.
Fine, sir. Thank you so much, sir.
Thank you.
Uh, I would like to answer this question. There are few studies, Dr. Donthu, and few other studies are done in US, saying that lactobacillus has anti-Alzheimer property.
Okay.
So, and it says that this lactobacillus and other species might have anti-Alzheimer properties against D-galactulose, induced Alzheimer's disease. So there are 4 5 studies that I have gone through, not much, but yes, the studies are still on.
That's a
I
very
hope it has answered the. I have answered your question, Ritu.
Yeah, yeah, Deepika. Thank you so much. Thank you.
Okay.
Are there any more questions? You can write it down or you can ask. If not, then we'll end the session here. Okay, there is one more question. It is Simran Matta. She has asked, sir, memory lapses in young age caused by depression or any other disorder makes an individual more susceptible to developing dementia?
okay. I was expecting this question. Finally, this has been asked. Now, memory lapses in case of depression is limited to that particular episode. So usually what happens is that it's not memory lapse actually, it's a kind of forgetting where the memory is stored. Or the memory itself is not formed when a person is depressed. So that attention and concentration is impaired, because of that memory is not formed. So that is a basic thing what happens in case of depression that leads into something called forgetfulness. Now, there is something called recurrent depressive disorder where in the life, throughout the life, they can have many number of episodes. Now that has found to increase the chance of dementia over a period of time. Now, how much it causes, how many episodes, and all those things are not clear, but it is clear that mood disorders over a long period of time they can have cognitive decline. Now, whether specifically it is a risk factor for dementia, it is not very clear. So, I hope I have answered your question.
I hope everybody has asked their questions. So 3 more minutes are left for the session to end. You can ask one last question, small question. Simran has written, it does, sir. Thank you. I hope.
Deepika ma'am, I would like to ask you one thing. What is your experience in using meditation in preventing dementia? I found a lot of research saying that it does affect. What kind of meditation prevents dementia, and what is practicable?
Dr. Donthu, mindfulness and transcendental meditation, it has already been accepted by American Alzheimer's Association. And also there are few coordination exercises like eye and hand movement, hand and leg movement. These are also certain kind of meditative activities which are being accepted by American Alzheimer's Association, and many researchers are there. And I personally do not have any experience because probably I do not fall in that age. But whatever you are saying is, and whatever you have mentioned in the presentation is very apt. If we have the right lifestyle, it is all about the lifestyle and definitely about the genes. Even if you are at risk, you can prevent it. So that's the most important thing. So here we are talking about the prevention. You have talked about the prevention. So I think we all of us, we can prevent this. And yes, meditation is helping in neuroplasticity. It is also proven that mindfulness and transcendental meditation and different kind of other meditative activities like dancing and singing and playing instrument, etc., etc., helps in neuroplastic effect. and that is why there are n number of that is why there are certain meditative activities which are included in CBT, and there are different type of therapies which are basically formulated on that. If I, for example, we have MBCT, we have mindfulness based stress reduction, we have DBT, we have even REBT, that says accept unconditional acceptance. So basically it's about yourself.
Yes, lifestyle modification.
It's about lifestyle modification, yes. And Dr. Raj, it was a wonderful
Thank
presentation.
you,
And
ma'am.
we
Thank you.
have, I think, 85 plus candidates, and I still 40 of them have joined, and I think they have really enjoyed the session thoroughly with the kind of engagement that they have shown. It speaks a lot about your presentation, and we
Thank
are
you, ma'am.
really thankful that you have agreed for this presentation and shared your knowledge on this
I'm really
platform.
thankful for providing this platform, ma'am. I was like, when ma'am will call for the talk, the next talk, the last talk was last year, and this one. So it's nice being with you.
Thank you so much, Dr. Raj. Thank you so
Thank you.
much. And looking forward to such associations in future. We keep
Sure,
on
ma'am.
organizing the monthly webinar.
Sure.
And I hope all the audience and participants have liked it. Yes, Ritu and Smriti has already shared. Thank you so much, sir. So it speaks a lot.
Thank you, ma'am.
Thank you so much, Dr. Raj. Over to you, Disha.
Thank you, sir. Thank you for your insight on dementia. My grandmother had dementia while I was very small. I saw her die of dementia and she lost memory. She couldn't recognize anybody. So it was really helpful because since my grandmother had, I feel like my genetics are also there, my father, my mother, so I can help them and I can help myself even. So this was very personal even at some level, and I hope it was personal to other people as well because we know few people who have dementia. So thank you, sir. Thank you for this knowledge, and thank you for making us understand with patience, and thank you for interaction, everybody, for interacting, asking questions, asking very good questions. So now I would like to wrap up the session. Thanking you, sir. Thanking you, Deepika ma'am. Thanking everybody who's present here because the audience is very important. And we are going to upload this on YouTube. You can watch the recording. And we have free webinars each month. So you can follow the WhatsApp group. We will upload it and also on the Instagram. So thank you, everybody. Now I would like to stop the recording and you may leave now. Thank you, sir.
Thank you so much, Dr. Raj. Thank you so much, Disha. Thank you so much, all the participants.
Thank you,
Have a
ma'am.
nice
Thank you, Disha.
evening, all of you.